Hello, my name is Cameron Dillard, and I'm going to be doing my project on bioceramics and how they are used for bone regeneration. What I'm going to be covering today is what are bioceramics? What are the two main categories of bioceramics? How calcium phosphate plays a key role in bioceramics. And then I want to discuss sodium or hydroxyl apatite and its role in bioceramics. Then I will go over my 3D image of hydroxyapatite. Then what are some of the properties of hydroxyapatite and how it is used for bone regeneration? Introduction. What are bioceramics? Bioceramics are a specific type of certain material designed to be used for medical and dental applications. Here's a list of some of the few applications that bioceramics are used for. This includes tissue repair, bone regeneration, bone replacement, along with the creation of medical tools and different types of medical devices. There are two main categories in bioceramics. The first one is bioactive ceramics. These type of ceramics interact with the surrounding tissue and bone and can become incorporated into the bone over time, as well as biodegrade away. Second is bioinert ceramics. These types of bioceramics are designed to not interact with the body or bone and are made to not stimulate an immune response. Listed below are some of the major compounds that are used in both bioactive and bioinert materials. Next, I want to discuss the role calcium phosphate plays in bioceramics. So calcium phosphate refers to a family of inorganic minerals. There are many different types of calcium phosphates, and they are determined by their calcium to phosphate molar ratio. These groups of minerals are often referred to as CAPs in literature. And to the right, I have a list of materials and different chemical formulas along with their molar ratio. So CAPs have a key role in many bioceramic applications because both tooth and bone are made up of mostly calcium phosphate. They also have a structure and chemical properties that are comparable to bone tissue, and they help to promote bone growth and stimulate the growth of bone cells. Next, I want to talk about hydroxyapatite. This is also known as HA. It belongs in the bioactive group of bioceramics and is in kind of that subclass of calcium phosphates. Listed below are the calcium and phosphate and hydroxyl ions per unit cell. These components or atoms create a hexagonal crystal structure. And to the right is the structure of hydroxyapatite crystal. And this is what I based my 3D model off of. So per unit cell, there are 10 calcium ions, 6 phosphate ions, and 2 hydroxyl ions. This is my 3D model of hydroxyapatite. I created it in Tinkercad using the image before. So I have my calcium ions listed here in green, then my phosphate and my hydroxyl compounds in the corner. Next, I want to talk about the properties of hydroxyapatite. The size and distribution of HA crystals are dependent on which technique is used to make them. This significantly affects the mechanical and biological properties of the material. And there are 4 main techniques used to create the HA material. First is the dry method. This creates a grain size that has irregular shapes, along with having a slightly lower purity. Second is the wet method. This gives you more of a regular structure between the HA material and is the most widely used in production today. Third is high temperature processing, which creates the purest of the HA powders, but it leads to a formation of clusters, which decreases the surface area. That is one of the disadvantages. And lastly is the synthesis method. This extracts HA from kind of organic materials such as fish scales or eggshells. It works really well when it is to be incorporated into the human body, but it needs many other methods to remove a lot of the organic substances and materials to produce a pure hydroxyapatite. And the table to the right shows you the kind of wide range of tensile strength and bending strengths. It all depends on how porous and dense the material is, as well as the technique is used to create it. And lastly, how is hydroxyapatite used in bone regeneration? HA partially dissolves within the human body, which creates a newly formed layer. This allows for proteins to adhere to the surface of bone or tissue, thus creating and promoting stem cells to grow, and thus mineralization to occur near the bone and tissue. Next, the formation of blood vessels starts to occur, and this results in bone generation and the incorporation of the HA material of the implant within the natural bone. The rate of bone generation usually starts at approximately 14 days. This is the end of my presentation.